Hi, folks. Welcome. This is the third part of this series. This is the respiratory part three. So this one shouldn't take too long. This is just different diseases that we're gonna cover for the um, for the the exam. Sorry, my head. Um, First, we'll start with this: true or false? Horses only breathe through their noses. The answer is true. Okay, horses literally breathe through their noses. They don't breathe through their mouths. Okay, we do. We do. And same thing with kids, with babies. If you actually have infants, infants don't breathe through their mouth. They're not a mouth breather, so they don't know how to breathe through their mouth until much later on. So that's why if they have a cold early on when they were younger, in their infant time, like first few months, they will cry. They will start crying because they don't know how to breathe through their mouth. The only way they could breathe is through them, through their mouth because their nose is stuffy. Okay. True or false, between 1930s and 1950, asthma was treated with counseling. Sound weird to the point that it is actually true. Okay, they believe that wheezing was suppressed cry for his or her mother. We do weird stuff way back then, really weird stuff. So we do weird stuff. We'll talk about that later on. Next couple of weeks when we talk about reproductive system. We do even weirder stuff there. Okay. So first one, then we talk about asthma. So let's cover the asthma really quick. So asthma is a chronic condition, usually happen in the childhood. Asthma is associated with a couple of things. One is allergy. Okay. Usually when we talk about asthma, we talk about two things. One is when you be a little kid, and also one is you have allergic reaction because of the whatever could be food, could be pollen, could be anything that could cause you to have the shortness of breath. So technically speaking, asthma is difficulty breathing out. Okay, breathing out. It's not you don't have problem breathing in. Okay, so keep that in mind. It's a breathing out. You actually wheeze when you breathe out. Your throat closed down, so you have difficult time breathing out. So keep that in mind. It's not problem breathing in. The breathing in part is fine. They get the air in, but they have problem getting the air out. So that's why you don't see them turning blue, because they get the oxygen in, but they actually have too much carbon dioxide in their system, so causing them to become acidic. So the treatment usually is inhaler. We use inhaler to open up things, bronchodilator to actually open up their trachea and bronchioles to actually be able to breathe again. Okay. Usually most people just go away as they get older. So when they become adult, they actually gets better. This thing kind of goes away. You could have mucus producing into the lungs. It closed, so the air coming in is fine, but going out, have problem going out. Second one, if you're gonna be in a medical field, you're gonna see this term so often. You're going to see it on your daily basis, and you're going to kind of get sick of it. This is called COPD, chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease. Mainly, it refers to two type of people, and these are opposite folks. But you could end up with these when you actually smoke. When you smoke, you could actually end up with COPD. And you have two conditions. One is called the chronic bronchitis, and the other one is emphysema. Okay, so these are the two types of COPD. So usually it's caused by smoking or secondhand smoking that will lead you to this. Chronic bronchitis is basically you kind of similar to asthma in a sense, but you actually have a lot of mucus there, but you have problem breathing in. Okay, you have problem breathing in. So chronic bronchitis, think chronic folks, we call them chronic bronchitis, we call them blue bloater. So these folks, They blue because they couldn't get air in. They become cyanotic. They become blue so that they can't get the air in. Bloater because they actually have edema. They have edema in their system. They couldn't get the air in, so then there's actually they don't have enough oxygen, and they leaking out liquid in their interstitial space, causing them to become swollen, and they causing them to have edema. So we call them blue bloater. So that's chronic bronchitis. Emphysema is the opposite. Emphysema is you smoke so much that your instead of have a nice grape-like alveoli, those grape-like alveoli is actually been blown up. You think of you just blow, you pop all those grapes. Think of that bubble wrap stuff when you bubble wrap your package with. Imagine you pop them all out. When you pop them, it become flat, become really flat. So meaning that you don't let the air could come in just fine, but there's no exchange of the air into your bloodstream. Okay, there's no pressure. You lose the pressure of pushing those oxygen and the carbon dioxide in and out. Okay, so we call these pink puffer. Pink puffer. So pink is meaning that they opposite to blue, so they do get oxygen into the blood. But the problem is they cannot get rid of the air that's inside their lungs. They actually have CO2 built up in their lungs, inside their alveoli. Okay. So these folks, one thing to keep in mind, and this is something very important to keep in mind for a lot of you if you're going to become a nurse and doctors. For these folks, you don't want to give oxygen. No on oxygen. So if you give them oxygen, they could die. Okay. Remember, we talked about in the second portion, the second part, that your lungs is actually based on oxygen, CO2. Your lungs is actually based on CO2. The more oxygen you give them to them, you forcing the lower the level of the CO2, and you actually gonna make them actually increase the level of CO2 and causing them to become hyperventilated. You could have a respiratory arrest. You could die from there. So emphysema, don't give them that oxygen. You only give that to chronic bronchitis. Okay. Cause again, long-term exposure like smoking cigarette, fume dust. If you work in like a miners industry, you could get this as well. Secondhand smoke could cause you this as well. Next one is TB. TB is quick. This is it's a disease that actually keep coming back. This is a bacteria, Mycobacterium, which is bacteria tuberculosis. TB, we often think that it's only in the lungs, but in fact, you could get TB anywhere. You could get a TB in your nose. You could get TB in your mouth. You could get TB in your liver, your stomach. So you could get TB anywhere, even on your skin. So depending on location, it could affect anywhere in your body, but majority of the time, it actually affects your lungs. So what happened with TB is it actually usually stay on the apex of the lungs, so usually stay on the top. Okay, you will cough up blood. You will have sputum, bloody sputum. When you cough up, you have lots of blood. Okay, we could treat this. We actually have medication for this called isoniazid. Isoniazid is actually a long-term medication. Usually you take from 6 months to 2 years, depend. And you always have to take it at the same time every day for 6 months to 2 years. This is spread very easily, spread through airborne. It's actually a small particle spread through the air, so you can contract this very easily. For those of you who are actually born outside of the US, you actually have something called BCG. BCG is actually somewhat a vaccine for TB. But what happened is you get this when you're born. For those of you who were born outside, you're going to have a scar either on your arm or on your butt. You actually have a scar. More recently, the World Health Organization removed that BCG because it doesn't seem to help. So we stopped giving out BCG. But for those of you who's already had one, you will always test positive for your TB test. So if you're gonna need a TB test for hospital, just tell them you have BCG, and most of the time, if you're not coughing, they won't even do an X-ray. If you're coughing, they will do an X-ray to confirm that you don't have TB. It would look like this. Okay, so you will see a TB like that. So you will coughing out with blood. We do TB tests to see whether you have them or not. For those of you who are never had BCG, you will have to do this on a yearly basis. As long as you work in a hospital or medical field, you will have to get this done every year. So, risk factor: infant, elderly. If you have this, it's spread very easily, so you have to kind of contain, get treated. Once you treat it, it's okay. So we talked about emphysema already. Emphysema, pink puffer. You will also have, usually caused by smoking or secondhand smoke. You will have a clubbing of the finger, which is nice and round, it's curved nails. And a barrel chest. Your chest is nice and round as well, like little barrels. Again, do not give O2 to these folks. You will kill them if you actually give them O2. And that's the club nails or club fingers. That's what it looks like, nice and round. Kind of, it makes you think of Disney characters in the cartoon, like all the elephants and all the cartoon character have these nice round nails. Your nails are the window to your lungs. Whatever going on in your lungs, it will show up through your nails. So if you're a smoker, you will have certain kind of nail. Okay, if you're not breathing right, or you have asthma, you're also going to have that shown on your nails as well. Next one is PE, pulmonary embolism. Pulmonary embolism, this is when you have a clot inside your lungs. You have this blood clot travel from your leg, from your DVT. We talk about DVT in cardiovascular chapter. So that clot travel up your legs, go through your heart, and then get stuck in your lungs. Okay, so this is what we call PE. Usually is asymptomatic, and it happened very quickly. Once you happen, you don't even know what hits you. Okay, you have hard time breathing, you become cyanotic, you're gonna flop down on the floor. They have to take you to hospital immediately. Okay, and they'll use these scans, MDCTA, to actually scan you and look at the VQ scan as well, so to see what happened. Okay, and we have to remove or break down that clot to save your life. Okay, so think of PE, pulmonary embolism, is a clot. Emboli is a clot. So clot in your lungs, blood clot in your lungs, cause you to pass out. CF, cystic fibrosis, this is a lot of people are carrier. 1 in 28 people here in the US actually are carrier. And this is autosomal recessive, something to remember. Okay, so what happened with this, really in short, is that your body, your body actually retains sodium, won't let the sodium to come, retain chloride, won't let chloride to come out. You're supposed to secrete chloride everywhere in your skin, but that didn't happen on your GI tract as well. So chloride start to build up, combine with salt, combine with sodium, make salt, and those kind of leaks out through your body. Your body thinks those are bad guys, so they create mucus to fight those salt that's actually in your cell, causing you to have mucus in your blood, causing you to have a salty skin, and then eventually will start shutting down your lungs, shutting down your GI tract. Most of these folks usually will end up with lung transplant in their 20s or 30s. Their life expectancy now is a little longer. It's up to about 50s, 55 years old approximately, or 60-year-old. I believe last is 59 years old, last I heard, a few years back. So they could live pretty long. They could live a fairly good life, but they will have a lot of respiratory condition. These folks also very like, they won't do well with COVID. Those kind of diseases could actually make it a lot worse, kind of completely shut their lungs down. Okay, so we could test their sweat. So just remember, these folks, they actually have salty skin. So cystic fibrosis, CF, salty. You lick the skin is salty, which I don't recommend. They have mucus in their poop. They have mucus everywhere, mucus in their lungs, mucus in their poop. They have salty skin. Pneumothorax. Pneumos mean air. Thorax is in your lungs, so there's going to be air in your lungs, in your pleural space. When you have air in your pleural space, usually it just happens suddenly, so you're not really expecting it. Okay, you could see the lung collapse. So the lung should be this big. Now it's actually this big right here. Okay, so collapse down, because you have air buildup in your lungs. So in this, folks, you have a hard time breathing. You feel like someone is suffocating you because half of your lungs cannot breathe. I think the last one, I believe this is acute epiglottitis. Acute epiglottitis. This is your epiglottis here. You could see here, very nice. Your true vocal cord. This is your false vocal cord are here. Okay, so epiglottitis is your epiglottis become inflamed. You see how inflamed that is. Your epiglottis actually become inflamed, kind of closing your windpipe. Your windpipe you cannot breathe through this. So that's why they have to intubate. You can see right here they put a little tube in there so you could breathe to help with your intubation. So again, this is caused by a flu virus. Influenza, H influenza, just a flu. The key things to this is they oftentimes they have this what they call sniffing position. They lean forward because they feel like they cannot breathe, so they have to lean forward like this so they could breathe. They also have difficulty open their mouths. So if you see these guys with fever, and they said they have problem breathing, and they can't really open their jaw. Don't pry open their jaw. If you pry open their jaw, what that's gonna do is it's gonna close off the trachea. It's gonna close off this trachea. So you're technically gonna be killing them. So if they cannot open their jaw and they have fever and they have really sore throat and they feel like coughing all the time, send them to the ER. This is an emergency, definitely emergency. They need to get treated with antibiotics, steroids, intubation, so you name it, to kind of reduce down the inflammation. Okay, so this is emergency. So just recognize that they cannot open their jaw. If they cannot open their jaw, and they lean forward a little bit like this, okay, leaning forward the neck, and they have fever, send them to the ER. Okay, and that's it. That's it for this PowerPoint. Thank you for watching. If you have comment, please write down below. Thumbs up too as well if you like this video. Please make sure to watch the first part 1, part 2, and part 3. I will put up the urinary next. Okay. Have a wonderful week, and I'll see you guys later.